Welcome back. Let's continue with your bulletin now. Despite the Finance Minister's proposed cash injection into the health sector, critics warn that it does not go far enough to address the sector's myriad of challenges. The South African Medical Association trade union, which has been protesting over lack of jobs for the thousands of unemployed doctors, sees the funding as a necessary intervention. Well, for more on this, let's now welcome Dr Mvuyisi Mzukwa, who's the chairperson of the SA Medical Association, or SAMA. Doctor, it's great to have you on the show with us this afternoon. Welcome. So let's get right to the point of the recently allocated, or let's say proposed budget for the health sector. Do you think it will be enough? Looking at the current state of infrastructural decay, a report recently citing Helen Joseph as basically being in such a terrible state that it shouldn't be taking patients at this stage. But this is, of course, most, if not all, our public health facilities across the country.
Good afternoon to you and to your viewers, and thanks for having me in your program. Yes, indeed, the South African Medical Association has noted, this planned budget increase, especially to healthcare, from 277 billion rands, that is in 2024 and 2025, to 329 billion in 2027 to 2028. But also we noted that there was an allocation of about 28.9 billion to retain about 9,300 healthcare workers in the hospitals and clinics, and we think that is a positive step. But we're of the view that the budget remains very insufficient, as it covers only about 800 doctors, if you've heard the speech. We don't know what is going to happen about the other 1,000 doctors that remain unemployed. We're talking about qualified, polished diamonds who are sitting at home, who are trained by the system, but who cannot now be used to serve in the system, to alleviate all the difficulties that are out there in the system. So 800 is just a drop in the ocean, and we don't think, honestly, it is going to do a dent in the crisis that we're facing at the moment. So those 1,000, they remain jobless, even though we still have lots of shortages in the system. But also, we also noted that in the past, we lost about 9,000 medical professionals, in the past year alone. You can imagine what that does to the doctor-patient ratio. And it's worrying us as the Medical Association. And, we know also that there's a shortage of medical professionals, yes. Inadequate infrastructure, as you know, we've just spoken about Helen Joseph, insufficient resources, and they place this unbearable burden on the healthcare professionals and the healthcare system, and leading to poor quality healthcare, if you may add.
So this is exactly where these problems actually start, Doctor. The staffing issues, the budgetary cuts within the departments themselves. I mean, experts have warned that these healthcare targets are unrealistic. Besides this, of course, this new injection of about 280 billion rand. I mean, in terms of the current numbers, I know you've just made reference to high numbers of unemployed graduate doctors, nurses, as well as other hospital support staff. It's quite an ongoing issue across the board. It's not a new thing. So what do you suggest the department addresses these in the short as well as long term? It's so sad being subjected to scenes of young graduates picketing to get jobs, while at the same time we're hearing about staff shortages or the fact that government could not hire them without having provisions for their packages.
Well, the South African Medical Association is really calling on the governments to ring-fence, these allocated funds, because you'll recall what the minister was saying, as part of the equitable share, the funds would go to provinces, but provinces would not prioritize, healthcare in their allocation at a provincial level. So we're complaining. We're saying that provinces must prioritize the hiring of doctors, nurses, and other healthcare workers, so that we avoid, these problems that we're talking about, where you find that we have a poor quality of healthcare because of the dire shortages, and also the burnout on those that are in the system already. So we also then asking government and really calling on government to eradicate corruption. You can imagine how much money that we've lost. Just 2009 to 2013, we lost about 24 billion rands due to corruption. And we're still investigating about 14 billion or so that was lost due to COVID-19. And the 3.4 billion that was lost to corruption at Tembisa Hospital. So you cannot allocate this fund and do nothing about eradication of corruption in the system.
And yes, Doctor.
We also ask government.
Yes, go ahead, Doctor.
I was saying we're also asking government to expand and upgrade healthcare facilities. Particularly in the rural areas and the peri-urban areas, where you find that accessibility is a significant challenge there. So, like you heard about Helen Joseph, just recently. I mean, you will recall that this is the second report. The first one was from Rahima Musa Hospital, which was delivered by Professor William Makoba. And now we've got a second report. So the question is, why do we keep investigating and be told the same thing when actually we know what the problems are? And the problems are exactly as they are identified. And, the minister will be there, the deputy minister will be there, the premier, everybody will be there, and they will agree. And they will also agree to implement the recommendations. But nothing whatsoever, zilch, nothing happens after that. So we are calling upon government to act on these recommendations.
And when you do engage,
that we've noted.
Yes, Doctor. I mean, I wanted to say, while we're still talking on the issue of corruption there, I know that the Health Minister, Dr. Aaron Motsoaledi, there keeps alluding to the issue of, the overburdenness of health facilities due to also the issue of illegal immigration, adding to the higher demand of the low resources that our doctors are already struggling with in those health facilities.
Well, we think that they are using those people as a scapegoat because you'll recall that we've openly and publicly made a suggestion to them that they need to audit these foreign nationals, and go to SADC and say, SADC, here are your people, they must keep the data. And then they must go to SADC and say, here are your people, give us money to manage them or to service them in South Africa. They have not done that. The only thing that you have seen a very unprofessional behavior by the then health MEC in Limpopo, Dr. Poppy, who was shouting at the patient, very disgusting, something that should never happen in South Africa. So they don't talk to the politicians. They are supposed to be talking to SADC and point out the issues, the flooding of foreign nationals in the country, especially as it relates to the healthcare system. But you can't be blaming them if you're not doing your own work in the country.
We can't comment on the doctor's conduct at this moment, Doctor, because I suppose that is still an ongoing matter in regards to that. But I mean, looking forward now, with news of NHI supposedly being well on track to start with their first as well as initial phases of implementation, let's look at the overall impact then of from working conditions of hospital staff, while also addressing the many other challenges that are plaguing our health facilities. How do you think this is going to pan out?
We've been clear as the South African Medical Association. There are 6 pillars of the healthcare system. And this NHI is only talking about one pillar, that is finance. Without sufficient funding, we know that the model of funding that is being proposed is almost unworkable. It's not sustainable. Without addressing sufficient funding, sufficient staffing, infrastructure improvements, the NHI is going to fail. It's very clear. People can, deceive each other around the issue of the NHI. But if you don't address these matters, even the proposal that you come up with, the issue of corruption, you're pulling billions of rands in one place and you think that those corrupt people are going to watch. They are not going to do that. They are going to dip their dirty fingers of corruption in that bag. So we need to make sure that there is the corruption is eradicated. So NHI without these improvements is not going to be successful. It is not only coming from us as the South African Medical Association. ASAP, the Academy of Science of South Africa, pronounced on this issue when they had their report in 2023 August. They said, if there is no proper ethical leadership and governance, this NHI is going to fall on its face. And you noted the report of the health ombudsman. It spoke on the issue of leadership in the hospital, and that picture can be painted across the country.
Absolutely, Doctor. I mean, you call for government then to act upon their promises, particularly the health department. Let's hear these, Doctor. In your order, I mean, you are in, of course, the profession. You deal with these issues on a day-to-day basis. Outline them for us. Hopefully, they will, just take you up on your proposals and bring in new suggestions of formulating a working plan with those that are actually grappling with the challenges.
Yes, with the issues that I've already mentioned, I would add that the government should invest in training and retention, of healthcare workers, because we believe that if you don't do that, you don't retain doctors, you don't retain nurses and other allied healthcare professionals. You're not doing anything to prevent further skill losses. You are going to collapse the already collapsed system, and you can imagine what is going to happen with the quality and the outcomes in the healthcare system. We also need to strengthen the emergency, the chronic and preventive healthcare programs. You will know that we continue to have this burden of disease that is continuously growing, and we need adequate funding for that. It must be allocated to improve care services so that people can benefit from this. They are not turned away. In case that one of the patients here have been turned away because the chemotherapy was out of stock. We're talking about a patient with breast cancer. So you can imagine what is the impact that is happening to patients already if we are not investing properly in healthcare. But long term, I would argue that we need to invest in public healthcare initiatives, like preventive healthcare, and measures that are really important or essential to reduce disease prevalence, so that we have a healthier population. We must avoid this thing of waiting for people to go to hospital. They must not go there in the first place. They must not get sick. So we must not be afraid to deal with the issue of alcohol. We must not be afraid to deal with the issue of tobacco. We must not be afraid to deal with the issue of poverty and the water issue. You can't be bringing billions of rand if you are not preventing illness in the community.
And Osho, I suppose it's quite a mammoth task then for government to find this funding, Doctor, because of the announcement recently of the withdrawal or the halting of aid, international aid such as PEPFAR. So quite a lot of going back to the drawing board now needs to take place. But we're going to leave it there, Doctor. Thank you so much for your time and input this afternoon. That is Dr Mvuyisi Mzukwa there. He's the chairperson of the SA Medical Association, or SAMA.